Understanding the stroke. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke is a medical emergency, and prompt treatment is crucial. Early action can reduce brain damage and other complications. The good news is that many fewer Americans die of stroke now than in the past. Effective treatments can also help prevent disability from stroke. Symptoms. If you or someone you are with may be having a stroke, pay particular attention to the time the symptoms began. Some treatment options are most effective when given soon after a stroke begins. Signs and symptoms of stroke include trouble speaking and understanding what others are saying. You may experience confusion, slur your words, or have difficulty understanding speech. Paralysis or numbness of the face, arm or leg. You may develop sudden numbness, weakness, or paralysis in your face, arm, or leg. This often affects just one side of your body. Try to raise both your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Also, one side of your mouth may droop when you try to smile. Problems seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes, or you may see double. Headache. A sudden, severe headache, which may be accompanied by vomiting, dizziness, or altered consciousness, may indicate that you're having a stroke. Trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or a loss of coordination. When to see a doctor. Seek immediate medical attention if you notice any signs or symptoms of a stroke, even if they seem to come and go or they disappear completely. Think fast and do the following. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drift downward? Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? Time. If you observe any of these signs, call 911 or emergency medical help immediately. Call 911 or your local emergency number right away. Don't wait to see if symptoms stop. Every minute counts. The longer a stroke goes untreated, the greater the potential for brain damage and disability. Risk factors. Many factors can increase your stroke risk. Potentially treatable stroke risk factors include lifestyle risk factors, being overweight or obese, physical inactivity, heavy or binge drinking, high blood pressure, cigarette smoking or secondhand smoke exposure, high cholesterol, diabetes, cardiovascular disease, including heart failure, heart defects, heart infection, or abnormal heart rhythm, such as atrial fibrillation. Personal or family history of stroke, heart attack, or transient ischemic attack. Other factors associated with a higher risk of stroke include age. People age 55 or older have a higher risk of stroke than do younger people. Race. African Americans have a higher risk of stroke than do people of other races. Sex. Men have a higher risk of stroke than women. Women are usually older when they have strokes, and they're more likely to die of strokes than are men. Hormones. Use of birth control pills or hormone therapies that include estrogen increases risk. Complications. A stroke can sometimes cause temporary or permanent disabilities, depending on how long the brain lacks blood flow and which part was affected. Complications may include paralysis or loss of muscle movement. You may become paralyzed on one side of your body, or lose control of certain muscles, such as those on one side of your face or one arm. Difficulty talking or swallowing. A stroke might affect control of the muscles in your mouth and throat, making it difficult for you to talk clearly, swallow, or eat. You also may have difficulty with language, including speaking or understanding speech, reading, or writing. Memory loss or thinking difficulties. Many people who have had strokes experience some memory loss. Others may have difficulty thinking, reasoning, making judgments, and understanding concepts. Emotional problems. People who have had strokes may have more difficulty controlling their emotions, or they may develop depression. Pain. Numbness or other unusual sensations may occur in the parts of the body affected by stroke. For example, if a stroke causes you to lose feeling in your left arm, you may develop an uncomfortable tingling sensation in that arm. Changes in behavior and self-care ability. People who have had strokes may become more withdrawn. They may need help with grooming and daily chores,